A teenager builds an AI app that can spot heart disease in just 7 seconds. Could something like this shift how healthcare works around the world?
Today's date is May 15th, 2025. Let's ground this for a second. How does a 14-year-old even become the world's youngest certified AI professional? And what pushes someone that age to take on heart disease?
For Siddharth Nandiala, it all began with asking questions, just wanting to know how things work. He grew up in Anantapur, India, moved to Texas, and his family really encouraged him to keep exploring. That path led him to AI. He became the youngest to be certified by Oracle and ARM, which got him noticed. But he kept pushing. He wanted his skills to solve an actual problem.
But why heart disease? Of all the issues out there, what made him choose that, especially at his age?
He saw what heart disease does in the underprivileged areas. So many people don't even know they have it, and many can't get expensive tests. That's where his app, Circadia V, comes in. You use a smartphone to record heart sounds for 7 seconds, then AI analyzes them. It's meant for quick diagnosis, especially where resources are limited.
So, in practice, just hold the phone to your chest for 7 seconds. That's the whole process?
That's right. The app records, filters out background noise, and then uses machine learning to check for signs of over 40 cardiovascular diseases. The interface is made simple, so both doctors and patients get a clear explanation. No technical jargon.
But how does it stack up to traditional methods, like stethoscopes, ECGs, or a 2D echo? Is it really as accurate?
It's been tested on over 15,000 patients in the US and more than 700 in India, including in government hospitals in Andhra Pradesh. The accuracy rate is up to 96%. After the app flags someone, doctors confirm it with ECG and 2D echo, and cardiologists review the cases. So, in clinical settings, it stands up well against standard tools.
That's impressive. But what about noise? A lot of clinics aren't exactly quiet.
Noise cancellation was a core part of the design. They knew lots of users would be in busy clinics, not silent exam rooms. The trials included both city hospitals and rural clinics, so the results reflect those conditions.
Is the app out there for anyone to use, or is it still limited to hospitals?
For now, it's only in clinical settings, so hospitals and clinics. Siddharth's team is careful about ethics, data quality, and being clear about how the AI works. They're planning to scale up, but they want to do it responsibly. That means working with healthcare providers, regulators, and making sure patient privacy is protected.
And what are the main roadblocks for going global, especially in places with fewer resources?
Smartphone access is growing, but not everyone has one yet. Training for healthcare workers and infrastructure can be a challenge. Internet connectivity isn't universal, and medical AI regulations differ from country to country. Building partnerships with local health agencies and focusing on ethical use are both crucial steps.
Given that heart disease causes about a third of deaths worldwide, early detection is huge. But can this technology really reach the areas that need it most?
That's the goal. With faster, more accessible screening, the app could help identify heart problems before they become emergencies. Siddharth thinks AI can help make healthcare fairer, giving more people a chance to be diagnosed in time.
Are there risks, though? Like, could people be misdiagnosed or start relying on AI instead of doctors?
That's one reason it's not a consumer app. It's a screening tool, not a replacement for cardiologists. Doctors still make the final call, and the app is meant to prompt further checks, not replace them.
What comes next? How do they move from successful trials to broader use?
They're looking at expanding trials into more countries, teaming up with governments, and linking the app with different healthcare systems. They're also working to make the AI better at handling diverse patient groups and conditions.
So, stepping back, do you think innovation from young people like Siddharth could actually reshape healthcare, or is this more of a rare case?
Siddharth's experience shows what's possible when young people get the right support and tools. It's a reminder that important change can come from unexpected places, and the future of healthcare might be written by people we don't see coming. The real challenge is figuring out how to encourage more stories like his. What can we do to foster such environments?
That feels like a good point to pause. If a curious teenager and a smartphone can start to close gaps in healthcare, what would it take for that to become common?
Thanks for listening as we dug into how AI and youth innovation are changing heart health worldwide. Stay curious and keep asking the questions that move things forward.